welcome back to the Social Universe, where you learn the secrets of the social media through the social universe, and in many cases we learn the secrets of the universe itself. And today the universal principle that we're discussing in the form of a business is the creation of beauty. Of course, as we talked about, when you want to become beautiful, you should do as much as you can to eat nutritionally, think holistically, exercise, and that'll get you 3/4 of the way there. But those stubborn areas, those stubborn things, those wrinkles, those little pudgy spots, that's where you would come to Dr. Lee and Dr. Robledo, who would be able to help you in those different areas. So we were starting to discuss some of the areas that could be addressed through fat freezing rather than actual invasive liposuction, which I think is absolutely amazing that it's nearly pain-free. You know, you don't even have to do anesthesia, and there's a cool feeling, but it's not cold. You know, it's not like you're sitting there freezing and wishing that you had a jacket and a coat. So now. The other area, did you want to talk about more about that, or did we cover that pretty well? I think we...
Well, you mentioned it's not painful at all. If eating popsicles is not painful, yes, this is not painful. This is how they discovered how this works.
Good point.
Yes.
Because they discovered kids had dimples.
Exactly. Correct? Kids that eat a lot of popsicles, they're starting to develop dimples because they're losing fat on their cheeks.
So there's indentions, and so then it went from there. It's amazing. You know, the apple falls on Newton's head, and kids eating popsicles, you just never know where it was going to come from. So you know, one of the questions a lot of people ask is, you know, can I put my fat from liposuction into areas that are enhanced? So we talked about that a little bit, but do you want to talk about that specifically, how that is done?
Well, when we're going to harvest fat for fat grafting, we use special devices that, when harvesting the fat, preserves it in such a way that we're able to process it, clean it, and re-inject it immediately into the patient and give it the best chances of survival. So we usually do some type of liposuction, and then what we do is we harvest this fat from, preferably from the abdomen, and when we don't have enough fat in the abdomen, then we search other areas, alternative sites like the love handles and the thighs, and we usually try to mix the fat. We want to get a nice mixture because fat tends to have different lifespan, or half lives, and the fat from the abdomen, we find that it's the best, has the longest half-life.
Okay.
And so we try to use that whenever possible, and if not, we try to mix it a little bit with the other fat. But after we harvest the fat and after we process it, then we prepare for injection into the areas that we want to augment or enhance.
What are some of the areas that people like to augment? I think some of them are obvious, but you know, kind of make a list of the
popular areas, especially the face. The face is one of the areas that shows very easily when we're aging, because as we lose volume and fat becomes atrophy, then our face, our cheeks sink in, and then that gives it that, you know, older look. So that's a very popular area to augment. So we do a lot of fat grafting to the face. And other popular areas that people, you know, like is breast augmentation, a natural type of breast augmentation. Other areas, some people want augment their buttocks, so we do that too. And those are the most popular areas that right now that we do fat grafting.
We do hands.
Hands is we usually do that almost combined with fat grafting of the face, because most people that are aging also have their hands have lost enough volume and fat that you see all the little tendons, etc. So we try to fill them in and give them a nicer, youthful-looking hands. You know.
That's genius. That's amazing.
It's a very nice procedure.
That's great. And again, these are it's nature to nature, which is wonderful. Switching gears a little bit, what is the most effective treatment for acne scars? You know, so some of us didn't leave high school behind, and we're bringing the scars of high school with us. So how do we address that?
Sure. You know, the acne scars can be pretty stubborn to treat, and I know patients have tried many different things, including surgeries, but we find that the best way to deal with acne scars is primarily two ways. One is a skin resurfacing, primarily the CO2 fractional that we have available in our office. And the second best way, or just as good, it all depends on the area, how large it is or not, but fillers, and liquid fillers especially. And Dr. Lee is an expert in those areas, And with either one of those two methods, I would say you can achieve very good results with the acne scars.
Wonderful. Dr. Lee, did you want to talk about some of the liquid fillers a little bit?
Yes, the fillers that put in the pitted acne scars can last a good amount of time, depending on which one it is. Some of them last shorter, some are longer. We tend to use longer lasting derma fillers. With the filler being in the area, it actually stimulates the collagen regeneration too. Sometimes when the 3 years has passed, the filler should be disappearing. Your acne scar can actually not come back because of the collagen stimulation.
That's amazing. That's
Yes.
great. I know this has nothing to do with anything, but I actually started taking internal collagen internally, and it has done a lot for my joints. And just collagen creates youth. It recreates youth.
Yes,
Collagen
it does.
externally or internally. Make sure you consult the doctors before you start taking it internally. You have to do it the right way. But yeah, definitely, it's overall it's wonderful for health. So how about somebody who's currently in the middle of acne? What are the best ways to treat acne that's in the active form?
I think what we need to do is we need to stop the active lesions or try to minimize them. And we have some blue and red light treatments which help to maintain a nice, healthier skin, in the sense that the blue light tends to kill the acne bacteria and the red light tends to treat the active lesions. So a maintenance of that can go a long way in easing up some of the outbreaks. For more persistent outbreaks, we use combinations of microdermabrasions to clean up the skin, and for more aggressive treatments, we use Levolon. Levolon is a natural body acid, and it's called levolonic acid. And what we do, it's applied on the skin. We let it absorb for several hours, and then we activate it with a blue light. And this activation tends to kill the bacteria. It's absorbed by the damaged cells on the area that we're applying, and it helps to kill those cells. So these are the various treatments that we can use for active acne.
Great, that's good to know. So there is hope if you're out
Sure.
there having those issues. Go ahead.
I just want to add that oxygen facial is really, really good for acne skin. Actually, with active acne lesions, it's difficult to do a microdermabrasion or even a regular facial, but the oxygen facial utilizes oxygen and little droplets of saline to clean deeply into the pores without touching it. It creates a very refreshing feeling and clean skin, which helps to prevent acne recurring.
Wonderful. Madonna's out there promoting the oxygen treatments. What do you guys think of that?
I think there's some truth to it.
Okay, great. Can they get that treatment with you guys?
Yes, we do have that.
Okay, so if Madonna says it's true, it must be. Come down and see Dr. Robledo and Dr. Lee. All right. Now, switching gears a little bit, back to skin tightening. Is skin tightening mostly for the face, or can you tighten skin across your body?
We have multiple clients asking, can we do it all over to my face and body with our new technology. It's called Viora, radio frequency skin tightening.
Mm-hmm.
Viora is a innovative new radio frequency treatment that has a multi-wavelength that can reach different depths of the body depending on the area that need to be treated. All over the body, skin can be treated for tightening purpose.
That's amazing. Again, for somebody like me who lost 85 pounds, I think skin tightening is a good idea.
You know, in the old days, radio frequency has actually been around for many, many years, but it fell in disuse because the older models, they were not able to adjust the frequency to get to the right depth. But the new radio frequency machines or devices that are out there now, that's the nice thing about them. You're able to adjust it so you can determine if you want to go deep or not, and that way you can address the various areas in the body. Now it's more effective. And it's actually probably the number one skin tightening treatment. Before it used to be the lasers, you know, for skin tightening, or ultrasound. But I think radio frequency, because of the adjustment of the frequencies now, has become the number one skin tightening procedure.
Okay, wonderful. And also, switching gears a little bit and going to cellulite. And before we go to cellulite, I want to talk a little bit about the difference between, do you say it lipolysis? Or
Laser lipolysis.
Laser lipolysis, so your actual difference between that and traditional liposuction. Obviously, one's very invasive, but is there a specific answer for that when people are asking?
Sure. Laser lipolysis is the destruction of the fat using a laser. That's what the term means. And we use that when we're interested mostly in delivering heat to an area, because not only we destroy fat, but we heat up the skin to create the skin tightening effect. Okay. And so for small areas like the neck or the jaws, it's very easy just to use a laser to create that laser lipolysis, to melt a little bit of fat, because it's not a whole lot of volume of fat. What you're looking for is mostly the skin tightening effect, which is what you get with the laser. Liposuction is actually the removal of fat, and that is removal of big volumes of fat. It's not melting it, it's actually being removed practically intact.
Okay.
And we use that especially if we plan on using that fat later on for fat grafting.
Absolutely. You definitely don't want to waste anything if it's natural, so that's great. So is a good way of saying it is you want to be able to use liposuction or the fat freezing concept when you want to get rid of fat, but when you just want to do skin tightening, the laser lipolysis is a good way to go.
That's correct.
Okay, great. We're going to go to break once again. I appreciate our listeners sticking with us. We will all be extremely beautiful by the time we're done just thinking about all this. So don't go away, and improve your beauty when we come back from commercial break.